My name is Ben Tribble. I'm a general surgeon at Prisma Health Midlands. I grew up here in Columbia and, of course, went to high school locally. Went on to Clemson University to college. I was thinking at that time I would study engineering, and I did. I studied chemical engineering and finished in chemical engineering at Clemson. I also did pre-med at the same time, thinking that maybe I would go to medical school, and in the end, medicine won out in my mind, and I went on and applied to medical school. I chose Vanderbilt. I went to Vanderbilt in Nashville, Tennessee. We stayed there for 4 years, and from that point, I needed to choose a specialty. I chose general surgery. Went on to Winston-Salem, Wake Forest University to spend 5 years training in general surgery. My specialty of general surgery is a rather broad specialty. We do a lot of different types of operations in general surgery. I think of myself as a general surgeon. I do a lot of general surgical operations, but I'm also a metabolic and bariatric surgeon. The specialty is sometimes called bariatric surgery. Often these days we call it metabolic and bariatric surgery because the operations involve changing people's metabolic diseases such as diabetes, sleep apnea, hypertension. So we do like to focus on that as well as the obesity. When patients come into office, a lot of my role is to try to educate them. Many of them have problems that are partly solved by lifestyle changes, diet changes. I deal with a lot of obese people, a lot of them because we're going to do bariatric or metabolic surgery, but a lot of them is other types of surgery. And it's important for me to talk to those people about what I know about diet and exercise and the relation of those two elements in controlling one's weight. And not just weight, controlling somebody's blood sugar and sleep patterns and many different things. And I don't think of it as my major role. I'm a surgeon. I'm not the patient's primary care doctor, but anytime I can add to their knowledge or emphasize something that maybe their primary care doctor has told them before, I think it's probably useful for the patients to hear it from me as well. So I do spend a good bit of time working with my patients in that regard. When I'm not working, I enjoy my time off. I love to be outdoors. I hike quite a lot, sometimes just here locally, sometimes out of town in the mountains, usually involving my family, sometimes friends. I enjoy many different sporting activities. Over the years, I've had different sports that I enjoy participating in, and right now I'm stuck on tennis and mountain biking, but that can change. Over time, I evolve and do different things, but I do like to stay active. If someone is interested in seeing me in the office for our general surgical program, we ask that you have your primary care provider make a referral, and we would love to see you. As it relates to the Weight Management Center, where we do metabolic and bariatric surgery, we would appreciate your primary care provider making a referral, but those patients are welcome to call the office and make their own appointment if they wish.